This is Dr. Michael Morgenstern with Medwiser, bringing you an update on monkeypox, the new outbreak taking place in the United States. NPR recently reported that monkeypox outbreak in the US is bigger than the CDC reports. Testing is abysmal. And then they start to go through a narrative of an individual who thought was infected with monkeypox, and it took a long time for him to get tested for it and diagnosed. What is monkeypox? A virus that has been infecting people in sub-Saharan Africa for, I believe, thousands of years. It's a viral disease that spreads. It's called a zoonotic infection, which is something that spreads from animals to humans. The rash is compared to the smallpox rash. It also could look like a chickenpox rash, and we'll get more into that in subsequent videos. But in general, there's not so much experience with monkeypox because it wasn't so much on our radar. The thought was that most of the infections were taking place directly from animals to humans. That's a little bit concerning in our case over here because it seems like there's a lot more infections taking place in the United States. The question is, are we dealing with a different strain of this virus than has existed in the past? According to the story in NPR, there was a scientist who thought he was infected with monkeypox. So he starts to go to a doctor's office and say, look, I want to be tested. The doctor says, look, this sounds a lot like an STD because his symptom was rectal discomfort and he had some swollen lymph nodes. Instead, the doctor said, look, it sounds like an STD. I'm going to test you for a sexually transmitted disease. Those tests came back negative, but the pain was getting worse for this individual. He goes into an urgent care and asks for a monkeypox test. Now, most places don't have this test available because this is not really something that has been endemic in the United States. It's not something that is commonly tested for. They give him antibiotics instead, treating him for a bacterial infection. Monkeypox is viral. It doesn't get better. It gets really bad. It's interfering with his sleep. He goes to an ER in a major, big academic hospital in New York, and the infectious disease individuals see him, and they don't think it's monkeypox. They say, look, this is not monkeypox. We're not testing for that. A few days later, he ends up with skin lesions or a rash, and that's a key sign of monkeypox because it's more specific for monkeypox. At the time of this particular article, when it was written, there were about 200 recorded cases of monkeypox in the United States. That could have been a big underestimate. According to some epidemiologists, they said, look, we don't really contact trace here. We don't know how many people are falling under the radar. Also, we don't have very good testing. If you remember with COVID, if you got infected, it would be reported and the Department of Health would contact you, and then they would give you the opportunity to get treated. They would give others the opportunity to know that they were in close contact with a person who was infected. This way they could go and get treated, or they could quarantine themselves so that they wouldn't infect other people over here. And also in the United Kingdom, Spain, and Germany, where they have, at the point of this article, 800 and 500 infections, there's no contact tracing going on. So of course, it is spreading at a rate that's probably falling under the radar and infecting a lot more people. The bottom line is we don't know the scale of what's going on. If you look at some of the information about it in New York, which is the epicenter of this virus, apparently New York is the epicenter of every virus, as it was for COVID as well. New York is reporting, as of July 20th, 756 confirmed monkeypox cases. That is a lot of cases. According to the New York State Department of Health website, monkeypox spreads through close physical contact between people. It means anyone can get monkeypox. However, based on the current outbreak, certain populations are being affected with monkeypox more than others. This includes men who have sex with men. Based on previous outbreaks of monkeypox around the world, some groups may also be at heightened risk for several outcomes if they contract. This includes people with weakened immune systems, elderly, young children under 8, and pregnant people. I mean, that is typically what you could say for any disease. I mean, somebody who's immunocompromised, somebody who's old, somebody who's a child, somebody who's pregnant, these people are at a higher risk of having complications. At the time of the article, again, CDC had given information to the New York Times that they had performed about 1,000 tests, and close to 30% of those tests were positive. That's a pretty high positivity ratio. The good news with monkeypox is that there is a vaccine that works for it. It's similar to the vaccine that was used for smallpox because the two viruses, monkeypox and smallpox, are related. a smallpox vaccine offers or confers protection against monkeypox. The other good factor is that from previous information on monkeypox, it is less contagious than COVID. There's a figure called R0 that tells you for one person that gets infected, how many people do you expect that to be passed along to? With the original strain of COVID, it was probably anywhere from 2 to 3. So for every person, then you're going to expect another 2 or 3 to be infected. If the number is less than 1, you expect that the disease on its own is just going to burn out. The problem is that these are all estimates. Since this virus has been discovered in the 1950s, the problem is that we don't have so much data on it. We could be dealing with a different strain. Maybe that's why we're, for the first time, seeing it spread in different areas. There is always the risk, and you don't want to alarm people, but there is a risk this disease has been artificially modified. We hope that it is the same strain and hope that it's containable. The other thing is, what is the mortality rate for this particular disease? And there's not good data on it. So it's somewhere between 1 and 10%. That's a huge range. If you remember with coronavirus, we had something very similar. It was coming out that in the beginning, the coronavirus was causing very high numbers of mortality. And that tends to be the trend in the beginning of an epidemic, especially when it overwhelms hospitals and overwhelms healthcare systems. Depending on how contagious a particular disease is, it can be better or worse. We're certainly better prepared this time around, but you would think that we just had COVID and things should be pretty smooth to handle this. The biggest benefit is that the population as a whole is ready for it. I think the population as a whole has a lot of information and a lot of power in terms of the way that these things can be monitored, in terms of the way that we can control an epidemic. This is a matter of educating the public and also a matter of educating doctors so that, like this individual that was reported in NPR, they get the right treatment quickly. I think that most healthcare providers are going to start being on the lookout for this. I think the CDC can do a good job of educating doctors about it throughout the country so that they can get the right treatment quickly. If there is a breakout in a particular area, they really should be doing contact tracing so that they can find the people that are infected, isolate them, and make them aware of the fact that they've been exposed. By doing this, we'll be able to stop and prevent the spread of monkeypox becoming anything like what we've seen with COVID. But I think it's important to be vigilant and to be aware that we often don't have the information we need right in the beginning. If we're dealing with another strain, we need to be very, very careful and vigilant and not undermine what is going on right now by assuming we know things when in fact we know very little.